something that might be familiar: rheumatoid arthritis. Ever felt unexpected pain in your small joints? How do you deal with it? Have questions about rheumatoid arthritis and how it's diagnosed? Share your thoughts and tips on managing joint pain. Let's create a supportive space to learn from each other. Meet Megan, a vibrant teacher who loves shaping young minds. Recently, she found herself in a challenging situation as her hands, particularly the small joints, started causing discomfort. Concerned about the persistent pain, she decided to seek help from a specialist. Upon visiting the specialist, the doctor recommended a series of tests, including blood tests and a bone scan. The wait for the results felt like an eternity, and Megan anxiously sat in the doctor's office, yearning for answers. Finally, the results arrived, and Megan learned that she has rheumatoid arthritis. The news was undoubtedly overwhelming, and a wave of questions flooded her mind. Turning to the specialist, she asked, "What does this mean for me? How will it affect my life?" In a caring and empathetic tone, the specialist explained that rheumatoid arthritis is a chronic condition where the immune system mistakenly attacks the joints, leading to inflammation and pain. The doctor assured Megan that they would work together to manage the condition effectively. The specialist discussed treatment options, emphasizing the importance of early intervention to alleviate symptoms and prevent joint damage. Megan, though understandably concerned, felt a sense of comfort knowing that a plan was in place. The doctor further explained that rheumatoid arthritis varies from person to person, and the goal of treatment is to improve Megan's quality of life by minimizing pain and maintaining joint function. The specialist encouraged open communication and assured Megan that they would be there every step of the way. Rheumatoid arthritis, RA, is an autoimmune disease that is chronic, ongoing. It occurs in the joints on both sides of your body, which makes it different from other types of arthritis. You may have symptoms of pain and inflammation in your fingers, hands, wrists, knees, ankles, feet, and toes. Uncontrolled inflammation damages cartilage, which normally acts as a shock absorber in your joints. In time, this can deform your joints. Eventually, your bone itself erodes. This can lead to the fusion of your joint, an effort of your body to protect itself from constant irritation. Specific cells in your immune system aid this process. These substances are produced in your joints but also circulate and cause symptoms throughout your body. In addition to affecting your joints, rheumatoid arthritis sometimes affects other parts of your body, including your skin, eyes, mouth, lungs, and heart. RA usually starts to develop between the ages of 30 and 60. But anyone can develop rheumatoid arthritis. In children and young adults, usually between the ages of 16 and 40, it's called young-onset rheumatoid arthritis, YORA. In people who develop symptoms after they turn 60, it's called later-onset rheumatoid arthritis, LORA. Rheumatoid arthritis affects everyone differently. In some people, joint symptoms develop over several years. In other people, rheumatoid arthritis symptoms progress rapidly. Many people have time with symptoms, flares, and then time with no symptoms, remission. Symptoms of rheumatoid arthritis include pain, swelling, stiffness and tenderness in more than one joint. Stiffness, especially in the morning or after sitting for long periods. Pain and stiffness in the same joints on both sides of your body. Fatigue, extreme tiredness, and weakness. Everyone's experience of rheumatoid arthritis is a little different. But many people with RA say that fatigue is among the worst symptoms of the disease. Living with chronic pain can be exhausting, and fatigue can make it more difficult to manage your pain. It's important to pay attention to your body and take breaks before you get too tired. The symptoms of a rheumatoid arthritis flare aren't much different from the symptoms of rheumatoid arthritis. But people with RA have ups and downs. A flare is a time when you have significant symptoms after feeling better for a while. With treatment, you'll likely have periods of time when you feel better. Then, stress, changes in weather, certain foods or infections trigger a period of increased disease activity. Although you can't prevent flares altogether, there are steps you can take to help you manage them. It might help to write your symptoms down every day in a journal, along with what's going on in your life. Share this journal with your rheumatologist, who may help you identify triggers. Then you can work to manage those triggers. The exact cause of rheumatoid arthritis is unknown. Researchers think it's caused by a combination of genetics, hormones, and environmental factors. Normally, your immune system protects your body from disease. With rheumatoid arthritis, something triggers your immune system to attack your joints. An infection, smoking, or physical or emotional stress may be triggering. Scientists have studied many genes as potential risk factors for RA. Certain genetic variations and non-genetic factors contribute to your risk of developing rheumatoid arthritis. There are several risk factors for developing rheumatoid arthritis. These include family history, sex, smoking, and obesity. Your healthcare provider may refer you to a physician who specializes in arthritis, rheumatologist. Rheumatologists diagnose people with rheumatoid arthritis based on a combination of several factors. They'll do a physical exam and ask you about your medical history and symptoms. Your rheumatologist will order blood tests and imaging tests. The blood tests look for inflammation and blood proteins, antibodies, that are signs of rheumatoid arthritis. Your rheumatologist may order imaging tests to look for signs that your joints are wearing away. In some cases, your provider may watch how you do over time before making a definitive diagnosis of rheumatoid arthritis. Diagnostic criteria are a set of signs, symptoms, and test results your provider looks for before telling you that you've got rheumatoid arthritis. They're based on years of research and clinical practice. The most important goal of treating rheumatoid arthritis is to reduce joint pain and swelling. Doing so should help maintain or improve joint function. The long-term goal of treatment is to slow or stop joint damage. Controlling joint inflammation reduces your pain and improves your quality of life. Joint damage generally occurs within the first 2 years of diagnosis, so it's important to see your provider if you notice symptoms. Treatments for rheumatoid arthritis include lifestyle changes, therapies, medicine, and surgery. Your provider considers your age, health, medical history, and how bad your symptoms are when deciding on a treatment. Early treatment with certain drugs can improve your long-term outcome. Combinations of drugs may be more effective than, and appear to be as safe as, single